The Middle East and Europe, welcome one and all. And we also have representatives from various industries present in this hall and also viewing us virtually. Thank you for joining us from all the various industries, including, of course, healthcare, government, tourism, and travel. And to add to that list, we have telecommunications, transportation, finance, and education.
Our stakeholders to align with our overarching plans in restoring the medical travel industry of Malaysia, as well as in the region. Ladies and gentlemen, we have an exciting 3 days planned out for you, featuring renowned international and regional speakers. I am confident that with our lineup of experienced speakers, we will gain better insight on post-pandemic recovery strategies and opportunities for industry resilience, from topics such as reimaging the healthcare system, the future of healthcare and well-being, and rebuilding the hospitality. Before I end my remarks, I would like to share with you that insigHT2021 was made possible this year thanks to the unwavering support of our stakeholders as well as our esteemed collaborators and partners. I would like
to be between 5.5 to 6.5%. So there's been a big change in the Malaysian landscape. From the days when there was a lot of pessimism, Malaysians are becoming more optimistic. And it is in that context that I welcome this big event. We have to prepare for the upturn in the Malaysian economy. And I see the healthcare tourism sector as one of the growth drivers for the Malaysian economy. I've been following this sector for many years. In my previous career, quite familiar with some of the numbers. And as we know, Malaysia is aiming to be a high-income economy by the year 2025. A high-income economy means a higher standard of living. A high-income economy means Malaysians enjoying higher levels of income, enjoying higher wages. We know that in
adolescent population, 12 to 17 years old. In just 70 days since we started the adolescent vaccination program, we delivered, as of today, 1 million booster doses to frontline healthcare workers as well as the elderly. And appointments are coming out on a daily basis for people who qualify for the booster dose to get their booster dose and protect themselves even more. Public health measures continue. We insist you wear masks. We insist on physical distancing. And this is based on science and best practices. We have seen other countries where they have abandoned public health interventions and they've seen their cases rise. Malaysia did one of two things. We invoked compulsory licensing for Sofosbuvir, which forced the drug company to sell to us at a lower price, to break the prohibitive pricing by the pharmaceutical companies. Secondly, we co-developed Ravidasvir, a new drug, with the neglected drug initiative, Drugs for Neglected Diseases Initiative, together with the Ministry of Health. Tan Sri Hisham right there was responsible with DNDi, Médecins Sans Frontières, a pharmaceutical company in Egypt, in developing a drug developed by developing countries, bringing hepatitis C treatment at the fraction of the cost for people to be treated. Congratulations, Tan Sri. Fantastic achievement. What this means is that Malaysia can be a center for Hep C treatment, for healthcare tourism, at a fraction of the cost Hep C treatment is around the world. Today, Pharmaniaga has come on the scene, Malaysia's largest listed integrated pharmaceutical group.
In 3, 2, 1.
Healthcare Tourism Council yang dikemukakan bersama oleh Yang Berhormat Khairy Mustafa dan saya sebagai Menteri Kesihatan. Hari ini kita juga telah umumkan satu produk baru dalam pelancongan kesihatan, iaitu Malaysia as a Destination for Hepatitis C Treatment. Dan ini dapat kita laksanakan disebabkan rawatan kombinasi Ravidasvir dan Sofosbuvir, ubat-ubatan yang berkesan dalam merawat penyakit hepatitis C. Dan kita akan memasarkan rawatan ini kepada pengembara-pengembara daripada luar negara untuk mendapat rawatan hepatitis C di Malaysia, yang merupakan rawatan jangka masa panjang, tempoh masa dalam 3 bulan lebih, untuk mereka bukan hanya mendapat rawatan di sini tetapi pulih di sini juga. Dan oleh kerana ini adalah rawatan jangka masa sederhana, bukan rawatan beberapa minggu sahaja, kita jangkakan kesan ganda, multiplier effect daripada rawatan mereka di sini akan lebih tinggi disebabkan mereka lebih lama di sini dan mungkin akan belanja lebih banyak di sini. Jadi saya ucapkan tahniah kepada Cik Daud dan rakan-rakan daripada MHTC kerana telah menyediakan satu blueprint pemulihan yang sangat-sangat baik, dan ini akan dapat disokong oleh sektor kesihatan swasta kita, ya, APHM, terkutip bersama
sakit hepatitis C di Malaysia dan juga untuk mereka yang datang ke Malaysia untuk rawatan.
Ada maklumat berapa hospital yang menawarkan rawatan?
Kita akan kalau pasti hospital swasta nanti kita mesti akan maklumkan, tetapi di hospital kerajaan telah pun kita mula rawatan kepada hepatitis C. Dan rawatan kita satu masa dulu bertumpu di hospital, tapi dengan kombinasi Ravidasvir dengan oleh dalam ubat oral, jadi kita telah pun decentralize the services ataupun rawatan ke klinik-klinik kesihatan. Jadi dan kita bekerjasama dengan FIND, ada Foundation of Innovative New Diagnostic, untuk mengesan kes-kes yang hepatitis C ini. Dan seperti kita gunakan RT antigen untuk mengesan. Jadi pengesanan ini boleh dilakukan di klinik-klinik, dan kita boleh mengesan dan juga kita boleh merawat. Jadi dalam tempoh 2030 kita jangkakan kita boleh tamat dan hapuskan hepatitis C. Apa maksudnya? Maksudnya kalau kita boleh elakkan ataupun tamatkan hepatitis 2030, kita juga akan melihat kurangnya kanser hati, paru hati ataupun liver cirrhosis, dan juga kurangnya kegagalan hati. Ini yang implikasi kalau kita boleh mengawal penyakit hepatitis.
For Ravidasvir, because we have worked on developing this drug together with the DNDi, which is the Drugs for Neglected Diseases Initiative, together with the Egyptian pharmaceutical company. Clinical trials were conducted together with Sofosbuvir. Now, Pharmaniaga will be manufacturing this Ravidasvir in Malaysia, and given together with Sofosbuvir, in which Malaysia was one of the few countries in the world to issue conditional compulsory license, which meant that we were able to secure that drug for a fraction of the cost. Now the pharmaceutical company is offering us voluntary license as well, which, although not as cheap as the compulsory license, but it's still a fraction of the original treatment cost. So this very decisive, a lot of political will, and also something that we felt was fair for people suffering from Hep C, has resulted in Malaysia being able to provide a combination of these two drugs for treatment, which yields highly effective cure rate.
That will answer. The second question has you answer the question. Thank you very much, Berdy. Okay, first and foremost, in terms of packaging Hep C treatment, right now we're working very closely with Pharmaniaga. Hep C is a silent disease, so people don't know sometimes they have it. So the first campaign, that first campaign has to go out very clearly and strongly. And this is where a platform such as insigHT, we are working very closely with Pamaniaga to have a joint collaboration together with the private hospital to promote Malaysia as the hub for Hepatitis C treatment. So first campaign is promotion for health screening to identify those patients, and then secondly, we want to have a package in terms of, as I was mentioned just now, cure and treat, and also have a vacation in Malaysia while going through the treatment within the 3 months. In terms of the procedure of coming in, we will definitely follow the existing SOP that is set by the government in terms of bringing in people accordingly, either through BTL or through the SOP that has been decided by the ministry. Thank you.
Dan kita menjalankan kajian, iaitu kajian menggunakan kombinasi baru, iaitu Sofosbuvir dengan Ravidasvir ataupun Ravida yang dikeluarkan oleh Pamaniaga. Dan kajian ini dijalankan di negara kita dan juga di Thailand. Dan keputusan kajian itu menunjukkan keberkesanan yang amat tinggi sekali, lebih pada 97% untuk sembuh, dan juga kesan samping yang amat rendah sekali. Dan ini adalah obat oral, dan berbanding dengan rawatan hepatitis C yang dulu kena masuk hospital dan kena obat cucuk dan sebagainya. Jadi dengan adanya kombinasi ini dan telah pun diterbitkan di jurnal Lancet, iaitu keberkesanan kombinasi baru Sofosbuvir dan Ravidasvir, kita jangkakan sekarang ini kita dah ada rawatan yang boleh kita beri kepada pesakit-pesakit hepatitis C, dan juga kita sekarang ini dalam proses untuk mengesan pesakit-pesakit hepatitis C, dan kita jangkakan mungkin ada lebih kurang 400,000 pesakit-pesakit yang belum lagi dikesan. Itu jangkaan kita untuk negara kita. Tapi sekarang ini dengan voluntary license kita boleh.
And back it's 3 months. So if you're 1 month short, then we will not give it. Yeah, but we will ask for you to wait for your appointment to be sent via insigHT or via an SMS message.
For to give every single adult in this country a booster dose. So what we have set aside right now is enough to vaccinate people who have not been vaccinated, as well as people who are going to be requiring the booster doses. So can't pull out the exact figure. If I can pull it out, I'll let you know.
When would our population be vaccinated, and has the administration of boosters affected our stretch target?
What target? Sorry?
Like, when would our population be fully vaccinated?
I mean, if you look at the statistics today, we have the adult population, 98% has received at least the first dose. So you're talking about 2% more. This is based on Dawson's denominator. So the question, when will we be fully vaccinated, really should be addressed at anti-vaxxers, because they will determine whether we'll be fully vaccinated or not. Those who are willing to be vaccinated, I'm sure everyone's been vaccinated already. So I think the target will depend very much on those people who refuse to be vaccinated. And that's about, at the moment on paper, that's about 2% of the population. But we continue to have outreach vaccinations, especially for those who we may have missed out, undocumented migrants, refugee communities. We continue to do this. They continue to receive their primary series. And in fact, perhaps when we open for walk-ins for the booster, we may allow for those people who are unvaccinated to also walk in. So that's a decision that I'll make this afternoon. The function of fully vaccinating the population is people who are unwilling to be vaccinated. It's not supply. We have enough vaccines to cover people, 100% of the population, and to give a booster shot to every single adult population in our country.
Thank you very much for your